Hello everyone, welcome to our YouTube channel for nurses preparation. I am Neeraj Kumar Kathal. Today we are discussing a very important topic, that is gastric lavage. It is also known as stomach wash. Let's discuss it. The gastric lavage or stomach wash is the aspiration of stomach contents and washing out of the stomach with a solution by use of large bore gastric tube. Why we are performing gastric lavage? First and main purpose is for urgent removal of ingested substance to decrease systemic absorption in case of ingestion of poison, to empty the stomach before endoscopy procedure, to diagnose and to arrest gastric hemorrhage, to relieve nausea and vomiting in case of acute dilation of stomach, pyloric stenosis and intestinal obstruction. To perform this procedure, which equipments we need? The list is large bore gastric tube, large irrigation syringe, large plastic funnel with adapter to fix tube, water soluble lubricant, gloves, tap water, normal saline or appropriate antidote, container for aspirate, suction machine, nasotracheal or endotracheal tube with inflatable cuffs, containers for specimen. Let's see the procedure. Remove dentures and inspect the oral cavities for loose teeth to prevent aspiration of teeth. Measure the distance between the bridge of the nose and xiphoid process and mark it because tube must enough to reach the stomach and avoid excess tubing that may curl and kink the stomach. Lubricate the tube with water soluble lubricant. If the patient is unconscious, intubate with cuffed endotracheal tube before placement of the nasogastric tube to prevent aspiration. Pass the tube either orally or through the nose up to the marked distance. Place the patient in left lateral position with lowered about 15 degree. It will allow the gastric contents to pull and decrease the passage of fluid into the duodenum during lavage. Aspirate the stomach contents with syringe before installing water or antidote to save the specimen for analysis. Ensure correct placement of the tube before installation. Remove syringe and attach the funnel to end of the tube. Elevate the funnel above the patient's head and pour the fluid into the funnel. About 250 to 500 ml fluid is to be introduced to reach all part of the mucous membrane of the stomach. Lower the funnel and siphon the gastric contents into the container or connect to suction. Save the sample for the first two washing. Repeat the lavage procedure until the returns are relatively clear and no particulate matter is seen. At the completion of lavage, the stomach may be felt empty if no further medication are required. An absorbent may be instilled in the tube and allowed to remain in the stomach because it reduces absorption of substances and renders the poison inaccessible to the circulation. Here absorbent is antidote. A saline catheteristic may be instilled in the tube to hasten the elimination of remaining ingested material. Pinch off or clamp the tube and withdraw it quickly. Keep the patient's head lower than the body to prevent initiation of gag reflex. Give a mouthwash and dry the face. Record the procedure with time and date, type and amount of solution used, the character of return flow, the condition of the patient before, during and after the procedure on nurse's record. So friends, this is the complete procedure. Thanks for watching.